Thank you so much for joining us tonight for our RTUK talks on the reality of cancer treatment for autistic patients, sponsored by AstraZeneca. A really warm welcome to you all. Although this is a series built for the workforce, we very much welcome anyone who has had a cancer or is going through treatment or diagnosis who's joining us here tonight. Last year's talks about new development and innovation were really popular and are still available to view on our website, as are the 4 talks from last year on this theme of enhancing the patient experience. So I'm Sarah. I'm the director with Radiotherapy UK, and we are here to improve outcomes for every UK cancer patient. And we do this by campaigning fiercely for fair access to timely treatment, because 1/3 of patients aren't receiving treatment on time. We advocate for the amazing radiotherapy workforce who tell us that they could do so much more if they had enough staff and the right equipment to deliver modern radiotherapy. And we also work to create really trusted, tailored, and down-to-earth patient resources. So it's a really key moment for the Catch Up for UK cancer treatment. And through our award-winning Catch Up with Cancer campaign, we're here to push for the big, the brave, and the bold changes that are needed for better patient outcomes. If you do find tonight's webinar or our wider work valuable, please do consider a donation to our campaign, and you'll find the link in the chat function. I'm joined here tonight by Lindsay, Alison, Tegan and Emma from our team who will help us run the session. Lindsay worked as a therapeutic radiographer for many years and will be helping out with the questions section later this evening. And Alison is going to be looking after our chat. Tegan is our new fundraising manager, and Emma supports the team with administration. So tonight's guest speaker, Dr. Char Goodwin, has some revealing and often pretty shocking insights to share on the experience of autistic people going through a diagnosis and treatment for cancer, including her own experience. Please do use our chat function to introduce yourself and to share your comments and your questions. This is such a good opportunity to engage with each other and with our speaker, and we will have a question and answer session scheduled after Dr. Goodwin's presentation. So without further ado, I will stop sharing and hand over to Dr. Char Goodwin.
All right, share my screen. Okie dokie. Is that all going? Thumbs up, all okay?
All going great, thank you.
Yeah. Okay, well, thank you very much for that introduction, and hello everyone. I'm very pleased to be able to talk to you tonight about experiencing what breast cancer is like when you're autistic. I'm a research fellow at the University of Exeter. My email's on there, so if you feel free to drop me an email if you would like to. Okay, so before I start the talk, there are a few things that I think are important to note. So firstly, I don't speak for all autistic people, because not all autistic people have the same experiences. There's a lot of heterogeneity in autism, and we also often have co-occurring conditions. Likewise, not all cancer treatments are the same. If we think about breast cancer specifically, there are many different types of breast cancer which will require different treatments. And intersectionality will also impact that cancer experience. But what I'll be discussing this evening is information based on the literature, as well as my personal experience. Another note as well about the language that I'll be using. So identity that the first language is preferred by the majority of the autistic community. In 2022, the Autistic Not Weird survey reported that 90% of respondents preferred identity first language. So that's saying I'm autistic rather than saying I am a person with autism. And that's also my personal preference. So I will be using I'm autistic throughout. The rule of thumb is to use identity first language, unless the autistic person that you are speaking to prefers different language. So what will I be talking about? I'm going to begin by talking about the barriers to healthcare for accessing healthcare that autistic people face, as well as they're moving on to the Autistic Experiences of Breast Cancer Research project, and that includes elements of my own cancer story. I will then discuss about how this all applies to radiotherapy, and what you can do right now. I often get asked how many autistic people are there in the UK, and this is not a simple question to answer. There've often been estimates saying that there are 700,000 people in the UK that have an autism diagnosis, but this is just not representative. In 2023, there was research that showed that there estimates to be 750,000 autistic people aged 20 years and over who are undiagnosed in England. So the figures are more likely to be over 1.2 million. And some of the reasons for this are because the NHS Adult Autism Assessment waiting list is years long. In September 2024, there were 204,876 people on the waiting list for an adult autism assessment. And this can be sometimes, this shows that there are not, in terms of the formal numbers, this is not representative. And also a number of autistic people self-identify, and they may not wish to have a diagnosis. They may not feel safe to disclose that they're autistic. And there will also be some autistic people who are unaware that they are autistic. So the actual true number of autistic people will be much higher than you think. And you will have had autistic patients. You may not know about it, and they may not realise. Autistic people experience barriers to accessing healthcare. And these barriers can happen in all areas of healthcare. And when there are no accommodations, these barriers can negatively impact that experience and can impact future access. In a paper by Doherty and colleagues, the self-reported adverse consequences of the healthcare barriers from that paper included delaying medical care. And so when you have a time-sensitive disease like cancer, this delay is going to have an impact. We all know that early diagnosis is better prognosis. So what kind of barriers are there? You often hear people say that if you're experiencing symptoms that could be a sign of cancer, just go to your GP and get it checked. We've all seen the adverts on from NHS England on TV that say just that. You know, if you're experiencing it and you're not sure, just go to the GP and get it checked, which sounds straightforward, right? But that just getting checked involves a number of steps, and that they can be difficult or more challenging for us autistic people. For example, in order to get an appointment, you often have to ring the GP surgery in the first place. But using the telephone can be really difficult for some autistic people and can be impossible for others. So there's a barrier right at that very beginning of just trying to get an appointment to go and see your GP. And if you do speak to a receptionist, it's then about describing the symptoms or pain that you are experiencing. Now, if you say you've got a lump, then a receptionist will hear that and think, right, I know what I need to do here. But what if you say something like, well, my breast just feels odd. I can't explain it. I don't really know how to explain it. It just feels wrong. Is that enough information for a receptionist to be able to offer you an appointment as urgently as you need one? So it's about being believed with what you're trying to say. And when you get there, there's the waiting rooms. They're often noisy and crowded with bright lighting and strange smells. And then when you get to see the medical professional, we always hear about the, one symptom per appointment is what you get told. If you need to talk about more symptoms, you need to book a double appointment. But how do you know if the one symptom that you have is the one that you need to talk about if you have multiple symptoms? And you kind of get confused and think, well, if I talk about just this one symptom, will that be enough? And then I don't talk about the other symptoms because I don't know if they're related or not. If I have to stick with the rules, then what do I do in this situation? I'll just go about that one thing and I won't tell them about all the other things I'm experiencing because I've only got one appointment. So it's trying to work out how you're supposed to even tell the medical professional what you're experiencing and describing those symptoms, especially to do like with pain. How can you describe accurately what is happening in your body? Often our outward expression of pain is a mismatch to the level of pain that we feel, and therefore is a mismatch to how it is perceived by other people. There's a paper by Bryce and colleagues who found that the medical professional's understanding of autism is what autistic people found to be most important when accessing healthcare. And if your appointment with a medical professional requires an examination, touch can sometimes be uncomfortable for autistic people, and it can be intolerable, or even painful sometimes. So just being examined in itself, because you're not knowing necessarily what's going to happen or how it's going to feel, can be a barrier as well. And then you get told what's going to happen, whether that involves medication or it needs to be a referral, and it's having to process that information. And all that's just before you've even got to a hospital with being referred for suspected breast cancer. And when you do get there, then you are faced with the hospital environment again, with the waiting rooms being loud and crowded with bright lighting. You see multiple healthcare professionals, and you're having to try and work out what's their knowledge of autism is. Do they understand about the heterogeneity of autism? And that's at each appointment with each new healthcare professional that you meet. Thinking about the sensory impact of tests, examinations, and procedures, and the information of processing that is involved when you have a diagnosis to understand what's actually going on and what's going to happen next. And the multiple treatment appointments and the side effects and late effects. And there were just so many appointments. And these barriers are repeated at every appointment, on top of breast cancer treatment. So how do we learn about barriers to healthcare? To be able to understand what it is like to experience cancer as an autistic person, we need to ask autistic people directly. And this is not including other people's perceptions of autism or what it's like to experience things, how you think it's experienced by an autistic person from healthcare professionals or family members or caregivers. And this is what we're doing in the Autistic Experiences of Breast Cancer project, which is a 3-year project funded by Breast Cancer Now. The aim of the project is to explore autistic adults' experiences of breast cancer diagnosis and to determine the autism-specific challenges and barriers to accessing breast cancer treatment. And this includes exploring what would have made things easier. I've put a QR code on there for our website if you'd like to have a look. And we're doing this in 4 work packages. The first one being an autoethnography, which has been completed. The second one is the interviews, which is what we're currently going through at the moment. The next one being a survey, and then the guidelines. And this is a research team that I am working with, a fantastic group of colleagues who have expertise in autism, healthcare, stigma, and breast surgery. So I thought I'd tell you a little bit about my cancer story. My life was busy. I was working full time. I was writing at my PhD. I'm married and I'm mum to 2 amazing kids. And one seemingly ordinary Saturday night, I found a lump. I told my husband and he said, you need to go and get this checked. And I knew I had to, but I felt quite reluctant to go. So I waited until I'd got to work the following day, and my work was quite far away from my GP surgery, and just said, oh, I can't possibly make it today to come and see you. I knew I'd give myself a day's grace to just think about it, and made an appointment for the following day. I went to the appointment. It was confirmed that a lump could be felt, and I was on the 2-week waiting the wait to go to the hospital for tests to see if I had cancer. So the mammogram, ultrasound, and biopsy. And in November 2019, I was diagnosed with a grade 2 invasive ductal carcinoma and DCIS in my left breast. And my treatment began in December 2019. I had a therapeutic mammoplasty to my left breast and a reduction to my right. And this was before COVID, so I was able to have them both at the same time. And then radiotherapy was coincided with the first lockdown. And halfway through my radiotherapy, I had to pause for 14 days to self-isolate because the rules had just changed. It was before we had tests, it was before we had vaccines, and understandably, I was told I had to self-isolate because my daughter had come home from school with a cough. And when I returned, I then had to return back after the 14 days to finish my radiotherapy. And I am currently on endocrine therapy, although I am due to have finished my 5 years of treatment next month. And throughout my cancer experience, I just struggled. But I seemed to struggle differently to how other people who had breast cancer. And I couldn't work out why. There was a lot of self-blame going on. I just thought it was me that wasn't able to cope. But what I didn't realize was I didn't know I was autistic at the time. And it wasn't until 18 months afterwards that I actually realized. And I did the usual deep dive into all things autism. And that's where I read about healthcare barriers. And I started to, I could relate to a lot of these healthcare barriers. And it made me start think back of my cancer experience. And I thought, if those healthcare barriers can occur at one appointment, what about when you have to go multiple times over a long period of time? What is that cumulative effect of those healthcare barriers that are experienced when you have cancer and you're autistic? And that was the motivation for the project. So the first work package, as I said, is an autoethnography. And so what I did for that is it's about my cancer story. And I thought back to how it was with how I experienced it from diagnosis up until the end of active treatment. And I can transport myself back. I can actually visualize and see in my mind the clinic rooms and the corridors that I walked down. I can remember what I felt like and remember what was going around in my head. And I just wrote about it all in chronological order. I also had some journal writings that I wrote 4 months after I finished active treatment that I called the cancer folder, when I was trying to process what I'd been through. And those two things became the kind of essentially the data for this autoethnography. And one of the big things that I became aware of was that whilst I was unaware I was autistic, it also meant that the healthcare professionals involved in my care were also unaware. But yet I still experience barriers to cancer care because I am autistic. And reflecting back on that now, and now I know I'm autistic, and looking back at that time, I can realize that there were barriers that I experienced. But as I say, without myself realizing it, and also the healthcare professionals realizing it, I just kind of got through it. I now have the language and understanding that I didn't have back then to explain how I felt. As part of our Autistic Experience Breast Cancer research project, we also have a lived experience advisory group. This is a wonderful group of autistic people who've had a breast cancer diagnosis, and they're there to help advise and co-design important parts of our project. So the interview questions that we have in the second work package, and the survey questions for the third, and then also co-designing the guidelines, because we want to make sure that what we are producing is beneficial to the autistic community. So that second work package, the interview study, is what we're currently doing, and I'm due to finish the last of the interviews this week. And we've already started analysing, because we analyse each interview individually. We then will look at all the interviews and see there's any similarities and differences through them all, but we're not looking for group norms. As I said before, the Lived Experience Advisory Group have co-designed the questions used in the semi-structured interviews. And we value each and every cancer story that is being shared with us, because it provides such rich, in-depth detail about what it's like to have breast cancer when you're autistic. The next work package, which will be later on this year, will be a nationwide cross-sectional study where we will be comparing the responses between autistic and non-autistic people who've had breast cancer and had their diagnosis and treatment within the UK. And again, the specific wording and the questions will be co-designed with the Lived Experience Advisory Group. And as we stand, we don't have any questions, because these are going to be informed by the autoethnography and the interview findings. And then from all the other work packages, all the findings that we have will be used to create a set of guidelines for healthcare professionals and providers to better support their autistic patients. We will also be providing recommendations for autistic individuals who are going through a breast cancer diagnosis and treatment. Again, as I said, these will be co-designed with our Lived Experience Advisory Group, and we would like these to be accessible for multiple audiences. And this is due to finish, as will be the whole project, due to finish at the end of May 2026. So I'm hoping, obviously, I've talked through the barriers to healthcare, and then now if we will look at how does this actually apply to radiotherapy. So if we take the planning appointment that you have to go to before you start your radiotherapy, and for one, I wanted to know what will happen during that appointment. What would that room look like? What kind of machines will there be? How many people will there be? How long will it take? As I've said before, being touched and other sensory sensitivities can make appointments be uncomfortable or intolerable or even painful. And those tattoos that you have to have, I really didn't understand how this would be done. And I kind of thought they would be using a professional tattoo machine, but was very wrong when I went to my appointment. But I didn't know, and I was never told. And I think it's also important to understand that a lot of autistic people will mask. And this means that they cover up their autistic characteristics to be able to kind of just get through whatever it is they're doing. And they have to learn kind of non-autistic behaviors in order to do that. So if we look at being touched again, it's kind of trying to tolerate it, even though it feels uncomfortable. And if it becomes intolerable and we get distressed, we can often be seen as non-compliant, rather than what we actually are is distress. So for my particular planning appointment, I didn't really know what to expect, although I had had a CT before. So I kind of knew what the machine itself was, but for the rest of the appointment, I just didn't have a clue. And I had a bit of a fiasco with my top that I was given at the very beginning. I was, when I was taken to just outside the changing room, I was handed a hospital top, which had the kind of poppers at the front. And I was like, pop this on. And then when you're ready, come through and we'll start the appointment. And I was like, okay, I'll do that. And then when I was in the changing room putting the top on, it became quite evident quite quickly that this top was going to be a very snug fit. And to the point where I was thinking to myself, okay, I can put it on, I can do it up. But if I take any deep breaths, this is going to fly open and I'm going to end up flashing everybody. And I was like, okay, well, I'm just going to have to just pretty much hold my breath for the rest of this appointment. And I kind of made my way through to the CT room. And as I got there, luckily, one of the radiographers who asked how I was doing recognized that my voice sounded funny as I was trying desperately not to breathe, and offered to say, would you like a bigger top? And I can genuinely say it did not cross my mind to ask for a bigger top, because I had been told to go and put this on, and that's what I went and did. I was trying to just deal with getting through the appointment with everything else that was going on, with all the other things that I was having to try and deal with, and I was just complying with what I was told to do. At no point did I sit and think I had options or there was a different something I could have asked for. I was very grateful that a larger top was given to me and I was able to put it on, and it was like, okay, this is great. I don't have to now go on some sort of crash diet. But it was something I didn't really need to have to worry about when I was going through everything else. And so something simple as just saying, here's a top. If it's not the right size, let us know and we'll get you a different one. That would have made such a difference. And once I was there within the CT appointment, I was like, lie down on here and we'll just be busy around you. And I know that was sort of sent as in the kind of, don't worry, just lie there. It's that word just again. But just lie there, everything will be fine and we'll just be busy around you. But that was actually really quite overwhelming because I had no idea what was going on. There was 3 people all doing different things, all moving around this room. I have a hearing impairment, which means I have no directional sound. So I could hear noises, but didn't know where they were coming from, and see people moving around. And I didn't quite understand what was happening. It all felt very rushed. It felt like a whirlwind appointment, and it was really quite overwhelming. And then it was all over very quickly. And then I was just sort of left to process what I'd been through. So when we're sort of having to look at treatment, the appointment times that you're given, sometimes we get told, oh, if you say ask for an earlier or a later in the day appointment, that's when it can be quieter. That could be a good, reasonable adjustment. But what about if you have caring responsibilities? A lot of autistic people have autistic family members, and that could include autistic children or autistic older adults. And having those routines that they have in place will be very important when you're having to deal with something like cancer in the family. My kids are both autistic, although we only knew my son was the only one diagnosed at the time. And I knew it was really important for them to have as much of the routine kept as normal as possible for them. So having to do the school run for them, which is what I always did, and that's what needed to be done. So I then had to ask for different times, but then that meant I couldn't get myself into a routine because they were all in slightly different times, which meant the travel was different, the traffic was different, the parking was slightly different, and it was difficult for me to get in routines. So it's not just about me being in a routine, but it's also about my family members' routines too. And as I was saying, with like getting to hospital and that, what happens when it goes wrong? We've all had some storms recently here in the UK, and travel has been affected as a result of that. And so there's things like that to bear in mind when travel, if you're having to kind of work out what you needed to do, if you have to be in for an appointment and suddenly something is stopping you do what you normally do, it can be very stressful. And what will the radiotherapy machine be like? What will it look like? What will it sound like? What's the process of the appointment? Will there be multiple scans or a single scan? What are the expectations? And the positioning as well. It doesn't look like it is in the picture where you can just sort of lie there and let it get on with you. But not for breast cancer anyway. And it's very different to just trying to practice in by putting your arms up in the air to see, to kind of imagine what it must be like to put your arms up when you have your breast cancer radiotherapy. And what about like music? Can patients choose their own music or not have music if there is some on in the room? And is that music loud enough to be heard if it wants to be heard? Think about, what about the lighting? You're lying down. So if there's any lighting above you, what's that going to be like? Is it going to be dimmed or is it going to be bright? And think about the temperature of the room as well, because you are lying there topless for, at least 15 minutes. It can get quite cold. On this one, in terms of the breath holds, this is an interesting one that really kind of threw me when I was going through radiotherapy. So my cancer was in my left breast, and I knew and had read that there was a likelihood that I would probably have to do a breath hold. So I would practice at home and in preparation. But then when I actually came in for my planning appointment, I was told that because of where my tumor was, I didn't have to do a breath hold. And this, I was like, wasn't expecting this. So I would ended up asking for confirmation at quite a few of my appointments to just double check, are you sure I don't need to do a breath hold? And it was like, no, you're fine. Just breathe normally. And we've got that word just there again. Because when you're lying there and you're not quite sure what's going on, and there's expectations, you're nervous, and just everything that you've been through, trying to just breathe normally can be quite difficult. I was lying there and I was thinking, right, okay, breathe in, breathe. Oh, I don't feel like I'm actually breathing quite normally now. And then I started to feel like I was panicking. And the more I panicked, I was like, right, okay, I need to start taking some deep breaths now, because that's what you do when you feel panicky. You take a deep breath. So let's take a deep breath. And then as I was taking a deep breath in, I thought, hold on a minute, I'm having radiation on there and I'm not supposed to do breath holds. I'm supposed to be breathing normally and I'm doing deep breaths. So I shouldn't be doing that. And this would go round in my head throughout each of the appointments, to just breathe normally. And why is it so hard to just breathe normally? But I felt I couldn't say anything to the radiographers, because how do you sit and say to someone, oh, excuse me, can you just tell me, how do you breathe normally? I'm not quite sure how to do it when I'm lying like this. It just seems quite odd. So you don't, and you just let your mind go into overdrive. And as I mentioned a bit about pain before, part of my story with radiotherapy ended up, I started off when I had to go and put my arm in the initial position for the first appointment. I was aware that I could feel it in my left arm. And I thought to myself, oh, I can feel that, but I think it's okay. The appointment's not too long. I should be okay. It'll be all right. But the pain increased each time as I went along, and I would start to sort of say, oh, it's a bit uncomfortable. And I would always get reassured that it won't be long, and we'll let you know as soon as you can release your arm. And so that's how the start of my radiotherapy was. As I said before, it was paused for 14 days in the middle. And by the end, as it came up to that time it was paused, it was getting really quite painful. And during the 14 days of isolation, I would essentially hold my arm and stop it hurting, because it had been hurting more, and I didn't realise that that was affecting it, and it would have caused more problems in the long run. The country was in a very different place back then. Because we didn't have everyone was still trying to understand what COVID was. There was a lot of things I couldn't have access to, so I just did what I thought was best, and that was to try not to hurt. So when I went back to my radiotherapy once the isolation was finished, my arm was really, really quite sore, and I would tell the radiographer, actually, is there anything can be done? My arm is really quite sore now. And I was offered some little cushions to try and sort of, squeeze in between my kind of arm as I was in the position, but it gave little relief. But for me, I thought, well, I've asked and I've been told we'll let you know as soon as your arm can be released. We've given you some cushions, and that's it. I'm just going to have to deal with this. I'm just going to have to deal with this pain. That became so excruciating that when I would finish the appointments, I would have to sit in my car for 5 to 10 minutes for the pain to reduce enough for me to be able to drive home. And I ended up losing a lot of mobility in my arm that required months of physiotherapy to regain that use. And whilst I was doing the autoethnography and looking back at that time, I started to realise that the pain that I was experiencing did not show on my face. So the radiographers would hear me say, this is really quite sore, but I didn't necessarily look. It was a mismatch to probably what they would expect somebody to be feeling, what I was feeling, and what actually showed on my face. So I ended up having to deal with the pain because I didn't present it in a way that was expected for the radiographers to be able to see, oh, maybe we could do something more here, or maybe we can offer you something. So there was this real mismatch. And when we talk about supporting autistic people, we are talking about supporting all autistic people, because not all autistic people will have a formal diagnosis. And an autism diagnosis should not be the trigger point that you have to be able to begin the accommodations that you're going to give. It shouldn't be that you're getting told this person's autistic and you think, right, brilliant, I will go and do X, Y, and Z, because I know that's what autistic people need. Because for one, there's not a one-size-fits-all approach, but also a lot of autistic people may not feel safe to disclose or wish to. I still don't tell every healthcare professional I see that I'm autistic, because sometimes it's just not worth it due to the barriers I've already explained. And also there'll be a lot of autistic people who self-identify, and so a formal diagnosis won't be anything that will trigger an accommodation if that's what you're looking for. And many people will be unaware that they are autistic, like I was. But it's important that all autistic people are supported through cancer. And I hope this talk so far has provided you with some knowledge about the barriers to healthcare and how the application it is to radiotherapy. So now I'm going to be looking at what you can do right now, so that when you go to work tomorrow, what things could you actually do to help support autistic patients? And the first thing is, you can ask everyone about how they would like to receive information. Offer options and don't wait to be asked. If you don't have various options, source them or create them. If you could do a video of your radiotherapy room and put it on your website, for example, just so that people can have access to it if they need to. And also remember to provide detailed information as well as plain English summaries. You can also ask everyone about their communication preferences. So how do patients contact you? Offer alternatives to the phone. And please avoid making last-minute changes, because they have a huge impact on not only the autistic patient, but also it can be their family members too. There's so much planning and organisation involved in attending all these appointments that these last-minute changes are very, very stressful. So work with patients about their appointment times, about when it is best for them and what works for them. And you can ask everyone about whether they have any sensory sensitivities. Look around your department. What could be a cause of sensory discomfort? Let patients know if there are any lights, for example, above the machines or in that room that can't be dimmed. or what the noise of the machine is going to be like. You could provide a sound of it on your website. And if you aren't able to reduce some of these barriers, then encourage comfort items such as dimming toys. I've been using one of these throughout just so I can focus. Ask people to bring in their own music, or if you can't dim lights, then suggest they bring some sunglasses if they say that lights can be a problem, or a blanket that can offer some nice sort of texture to hold. And please try and provide examples of what it is actually like to have a position that you needed to be in ahead of the first appointment. Don't leave it for the first appointment where you're going to be lay underneath, having the radiation when you first realise what position you're going to be in. And listen and read what is being shared with you and act on those responses. When you've had radiotherapy, you'll have multiple visits to radiotherapy sessions. So pass on the accommodations that are needed to the rest of the team that will be supporting that autistic patient. Don't leave it for the autistic person to educate healthcare professionals at each and every appointment. We've got enough to deal with already. And remember that patients are likely to have had plenty of prior appointments for cancer before radiotherapy, which means they've already probably experienced many barriers already. So to summarise, barriers to healthcare exist for autistic people, and we need to hear from autistic people directly about their cancer experiences, which is what we're doing on the Autistic Experience of Breast Cancer Research Project. I've highlighted some barriers within radiotherapy, and also that not all autistic people will have a formal diagnosis, but all autistic people should be supported through cancer. And I've also suggested ways to support autistic people right now by asking about information preferences, communication preferences, and sensory sensitivities. Thank you. There's my references as well. All done. Any questions?
Hi, hello, can you hear me? Am I unmuted?
Yep.
Sorry. Hi, Char, thanks so much. That was really great. We have got a few questions actually, so I'm gonna fire away with those. One interesting talk. One of our questions is how can we best assess pain and other symptoms if a person doesn't demonstrate with facial
I was going to sit here and look
expressions?
at the protocol. I didn't know how long it'd be. Awesome.
Somebody's not on mute. Okay, I'm muting.
Sorry, can you say that again, the question?
Yeah, so how can we best assess for pain and other symptoms if a person doesn't demonstrate with their facial expressions? What other, I guess, key factors might be present?
I think if somebody suggests, if they're not just or anybody doesn't necessarily have to know that they're autistic, but if somebody says that they are experiencing pain and you don't, and maybe it's a difference in what they're saying to what they look like in your experience, there's some kind of mismatch, then it will be about asking a bit more about what that pain is like for them. I think if I'd have been asked, does your, is the pain only whilst you're lying in this position, or does it carry on afterwards? Or if they'd even asked, like, is this something that stops you doing anything during the day? Then I will be able to say to them that, oh, no, it's painful all the time, and it's, I can't drive home easily because of it, which would have given a bigger indication of what I was experiencing, rather than just sort of hearing some words and not seeing me kind of, screaming in agony. So it's kind of investigating these words when you hear it. It's believing what you're being told and asking some information about it that might give you what you need as a healthcare professional to do your job, really, to find that extra information that you need rather than just taking it from that outward expression.
Thank you, that's great. What advice would you offer neurodivergent families going through a cancer pathway?
I wish I could turn around and say there are a whole ton of resources that I could pass on and say these are all the resources that would be great that you could use, but there aren't any. But obviously my experience started 5 years ago, and when I rang an autism charity, they said speak to a cancer charity, and when I was running a cancer charity, they said speak to an autism charity, and I thought, oh, what on earth am I supposed to do here? So I did what worked for my family and what my kids needed. And essentially, we, as I said, we kept our routines very similar. We had trusted adults that my kids would could get picked up from, and just kept everything as close to as normal as possible. But also, we talked quite factually about things. So we didn't kind of use I've kind of forgotten what your question is, but so basically we didn't really use things in, like, you can find sometimes you can get these books that tell a story about someone whose parent might have cancer, and it was like my kids wouldn't be able to relate to those, so we found ones that were a bit more factual, like this is what's going to happen, and then I would say how it might happen for me and what might be different with me and what might they need to do to help in those situations. There needs to be national guidelines. There aren't any at the moment. We're hoping that the project will provide kind of foundation of learning for people to understand and know more of what they can do and what they can ask for. But the biggest thing is it shouldn't be down to the autistic or otherwise neurodivergent patients to do everything themselves. It shouldn't be about having to manage everything. It needs to have other healthcare professionals to be able to go, do you know what, you're going through enough already. What can we do to support? These are the types of things that we offer as a way of support. Would any of this be of use to you? And just by offering that information, you're automatically telling that person that you are caring and that you want to help in any way as possible, because you're not just saying, what do you need? Because when you go through cancer, if you've got a primary diagnosis of cancer, you have no clue, you've never done it before. How do you know what you need? So being offered things and being given choices that you can say this will work, and lots of check-ins to see if things are still okay, I think is really important.
I've actually got a personal question, because I remember quite vividly, like, working as a therapeutic radiographer, and the breath hold and the breathing normally thing. Like, I've said it time and time and time again. And I suppose what would be a better thing to say? What would be something that would help you in that situation? Not saying breathe normally, because I can just hear myself saying it, you know.
I think they kind of could do with an appointment between the planning appointment and your actual radiotherapy appointment, or either between or before, where you get sort of have a chance to see what the positions is, where you can have a conversation and sort of say, well, you know, what will I need? You know, do I need breath holds? And if I don't, why don't I? Explain it, show it to me, you know, give me some kind of, rather than just, no, you're fine. Having more of that chance to be able to say, like, I might need the information. I mean, this won't, as I say, it's not a one size fits all. It's whoever, you know, is to support the person in front of you. Is, you know, if they say, like, I could really do with understanding a little bit more, it's like, then it might be like, do you want to come and have a look and see what one of these machines look like? Would it be helpful if you kind of got into that position before you have to on that first day? We're like, oh, actually, yes, this would be helpful. Do you have any questions about this? You know, we're not going to be doing a breath hold for you, even though it's on the left side. You may be aware of that, but these are the reasons why. So, and therefore, what we would say with this, it does feel a bit weird. This is what it sounds like. This is what the run through is going to be. And when we ask you to breathe normally, and that's just generally we were asking, you know, even if maybe there's a count, like breathe in for 2, you know, whatever the actual thing they could do. So you're not just lying there and suddenly all these thoughts racing through your head, and you're like, what do I do now? What do I say? You can't even put your hand up. You're like, how do I signal and say, help me, please? I don't know what to do, you know. And sometimes, like, yeah, how do you breathe normally?
Yeah. So I just like, yeah. I've got one final question, and there is a momentum for patient-led shared decision-making in cancer. How do you feel this could work practically, given the speed at which decisions are made and how many neurodiverse people have difficulties with decision-making and self-advocacy?
So I absolutely, they need to be involved in decision-making of their own care, for sure. But there does need to be recognition that processing can take a while, that there needs to be options for providing information in whatever way they need to have information, and then time to digest and process that information before being asked for a response. Now, I understand that there might be, in some cases, things that have to have fast responses, and that's not ideal, but there will be a lot of cases where you can give that person time. If you've got, you know, time, a day or two between appointments, anything. I often will have meetings or appointments where I just get through the appointment. That's my whole purpose, is just march my way through the appointment, get out the other side, recover after the appointment because it's exhausting, and then a few hours later might go, oh, hold on, I've got a question now what? So it's offering that time, you know, having that place or somebody to be that point of contact to say, I need to have those questions to ask, and checking understanding, providing it in the way it needs to be provided, and don't make any assumptions. If somebody asks for something that's not the norm, don't just automatically dismiss it because that's not how we do things. It would have been asked for a reason, or, you know, that you'll have to think of alternatives. There will be, if you've got somebody who finds touch painful and you need to examine them, then you can't just go, well, what, strap them down and still do it? You know, it's like, you think about how you can work around, and that's only going to be by having a conversation with them and trying to work out what can you do. So it's about talking with or communicating with an autistic person, and then really listening to the responses, and then it might be adapting the way you're doing something differently to what you normally do, and being open to that.
That's great. Thank you. I have got one more question here, actually. It's just come up. Are you still recruiting for your autistic experience breast cancer research project? And if so, can we direct patients who may be interested to participate?
So that's, we aren't for the interview. We will be opening up to the survey later on in the year. However, I understand that a lot of the audience members are likely to be NHS professionals. We don't, because of the ethics that we have for our project, is we're not able to recruit through the NHS. We will, however, be advertising on it in a variety of means. We are Googleable. I don't think that's a word. We can be Googled. And we will be advertising for participants for a survey coming up, so we will be able to that way, but we can't actively recruit through NHS means because we don't have the correct ethics to do so. But our website is available to that, and we will be updating that as and when we're ready to recruit too.
And Char, I don't know whether we could perhaps provide a link to that if anybody did, if we did want to, that would be fine. I think that's all the questions.